The following slide, I'd like to spend some time talking to you about some overlapping program initiative that's between quality strategy and MedTech. As Dr. Crane Ross mentioned earlier, Medicaid has started initiative focusing on improving child health quality improvement based on a quality improvement science. And those specific area that we have already committed working with MedTech program in the upcoming year. The top two area is based on the earlier work that developed by Beacon, as Dushka mentioned earlier. The upcoming year, we would like to take that effort and then spread it statewide. The area of focus include reducing and preventing catheter-related infection in the NICU setting. And also, the second area of focus is reducing scheduled pre- or near-term births. Those two initiatives, we are at the stage to spread the quality improvement efforts statewide. The third initiative, we are at the stage of just developing and designing a dissemination strategy to provide breast milk to low birth weight babies. And the fourth area of focus is to more focusing on children mental health care by enhancing the pediatric psychiatry network. Just a little bit background, pediatric psychiatry network is a infrastructure that developed by Department of Mental Health, and we are actively working with the department to focusing on some of the quality improvements to provide psychiatric consultation support to family and pediatric practice to help them more timely and effectively diagnose and treating children with behavioral health issues. As you all will know, that well known that a lot of time family and pediatric practice, they are not comfortable interacting with children with behavioral health issues. So using the PTNs, Pediatric Psychiatry Network, hopefully we can really provide that real-time or near real-time support to those practices. And we also like to improve child psychiatry clinical protocols. Our Medicaid data is very alarming. There are children that very young children under age 6 that were on our claims data show that they were prescribing at more than 6 antipsychotic medication. And so we would really like to work with the PBN throughout the pediatric expertise throughout the state to really look into those issues, and then hopefully we can develop some evidence or expert-based clinical protocols in terms of prescribing and treating the children with behavioral health issues. The quality strategy, there's some overlapping area that also identify a few quality improvement initiative. Earlier work based on Beacon's quality improvement initiative. There's one area of focus is on neonatal steroids for mothers at risk of premature delivery. And there's also some work already been done focusing on implementing solutions for pediatric safety. Keep in mind that quality strategy, the quality program initiative under quality strategy, some of them may already underway or some are under development. They may come across with MedTech program, but some of them may be outside of scope of the MedTech program. But we'd like to use this opportunity to bring to your attention those are the interest and focus area for Medicaid for next couple years. So likely those projects would have any new MedTech project would need to be in line with those direction. This there's a quality improvement initiative under evidence-based prevention and treatment practices to reduce high cost and prevalent condition. Currently, under MedTab, we have made major investment to invest the quality improvement infrastructure, namely to train a team of quality coordinators. They are kind of the ground soldiers, if you will, to help the state disseminate and help the practices improve their practice, and at the same time helping them collecting necessary process and outcomes data and feedback through this information infrastructure back to the state and share with the practices through a peer data analytic processes. This will be an ongoing investment for the next couple of years, so it's kind of the backbone for our quality improvement initiative. Under the Medicaid quality strategy, there are also several areas being identified as a quality improvement initiatives. They are very much in line with this year's budget. The number one is the health home development for chronically ill, and also Medicaid quality strategy have emphasis on behavioral and physical health integration and collaboration. We are also very interested in age-appropriate preventative services. Historically, there's a strong emphasis on EPSDT, the health check services, and upcoming we will be also put a lot of focus on adult preventive services. And again, we are wanting to improve processes and outcomes for the 6 clinical focus area using nationally recognized measures if they are available.